Meet Natasha. She is here to meet with her rheumatologist. Natasha has been living with lupus for 10 years. She is currently pregnant, but she is nervous. As can happen very early in pregnancy for women with or without lupus, her first pregnancy resulted in a miscarriage in the first trimester. She is concerned that this pregnancy will have the same result.
It will be important for all of us involved in your care to communicate often throughout your pregnancy. In addition to prenatal visits with Dr. Woods, you will need to see me here in the rheumatology office, as well as the maternal fetal medicine specialist, Dr. Jetty. I would like to be your point person and will coordinate your care with other providers, Dr. Woods and Dr. Jetty, as well as your primary care doctor, Dr. Williams. While this does not apply to you, for lupus patients with kidney disease, we recommend they also see a nephrologist. At our visits, we will do the usual tests we do to follow your lupus, such as antibodies and complement levels, as well as a urine sample to check for protein. We will also follow your liver enzymes.
Should I also see you more frequently?
You should see me at least each trimester, and even more frequently if you start to have a lupus flare or your blood tests or urine show anything abnormal. There are many reasons why we need to see some patients more frequently. They may include advanced maternal age, history of second trimester miscarriages, later than yours, kidney disease, anti-Ro SSA antibodies, a previous child with complete heart block, or other previous pregnancy complications. Studies have reported that being of Hispanic, Asian, or African American ancestry, being on antihypertensive medications, having a low platelet count, having an abnormal blood test called lupus anticoagulant, or having active lupus at the time of conception are risk factors for poor pregnancy outcomes. You are African American, but don't have any of the other factors that might increase your risk of complications. Of course, we will monitor you closely during your pregnancy.
Okay, this makes sense. Even though the lupus has been under control for a while now, can it flare back up during pregnancy? What happens then?
Good question. And yes, it could flare during pregnancy. But in general, this is not the case if your lupus is inactive when you first got pregnant. In the past, you've had joint pain and swelling, rashes, mouth sores, and hair loss with your flares. If you do experience a lupus flare during pregnancy, there are treatments that are safe to use. It'll be important for you to communicate with me and your care team immediately if you have a flare, so we can address it as soon as possible. When I say flare, I mean new joint pain and swelling, skin rashes, fevers, bad headaches, or bruises. And if you have other new symptoms and aren't sure if it might be related to lupus, of course, do not hesitate to get in touch.
Good to hear that there are options if things don't go exactly as planned. I'm hopeful that this pregnancy will be successful. Thank you for your help.
Of course, that's why we're here. Remember, communication is so important with all your doctors and healthcare providers. If any of them have questions or are unsure about your care, please have them reach out to me. I might even recommend that you try to coordinate some of your visits at the same time if possible.
Natasha goes on to have a successful pregnancy with the coordination of her rheumatologist, OB, and maternal fetal medicine doctor. They took a number of important steps to get there, which included Natasha's lupus remaining stable with minimal to no disease activity, and she was on medications safe for pregnancy at the time of conception. She and her doctor reviewed medications that were safe during pregnancy, her labs and risk factors for high-risk pregnancy, and she maintained close communication with her providers. If you are currently pregnant and were not able to plan in advance, it's not too late. Speak with your rheumatologist and OB/GYN now about next steps so you can have the best chance of a safe and healthy pregnancy.